Hi again and welcome back. This week we're going to restore functional movement and control of the neck. When dealing with pain and stiffness in the neck, shoulders, and the upper back, we have to consider the entire complex, the entire region, if we're going to restore function and decrease pain and stiffness. Focusing only on one painful area will give temporary results at best and just end up being frustrating for you in the long run. So, when considering the neck, the shoulders, and the upper back, typically what we see during the assessment is limits in neck range of motion, possible headaches, and shoulder tightness and pain. What most people don't realize is that stiffness in the upper back and shoulder blades that have lost mobility and control will cause the neck and shoulders to work harder. Even worse, the neck and shoulders sort of become confused about where movement and stability are supposed to be coming from. They essentially lose the ability to work independently, with the neck attempting to control the shoulders and vice versa. This leads to muscle spasms, headaches, limited motion, and pain. So today we're going to coordinate the function of the neck and shoulders to create dissociation. That is, we're going to restore the ability of the neck to move independently of the shoulders so that we can move independently and restore normal motion and stability and get you back to pain-free activity. So let's begin. Lie on your back and place your feet flat on the floor. If available, roll up a towel or place a yoga block between the knees and gently squeeze for the duration of the exercise. This is about a 30 or maybe a 40% squeeze. It's not attempting to crush the yoga block or the towel. This will gently activate the deep core of the spine, which can result in relaxation of the paraspinals, the muscles on both sides of the spine, as well as the shoulder muscles, resulting in more movement. Now place a 4-inch foam roll under the neck and grab a light resistance band with both hands. Keeping the triceps engaged and the elbows extended, pull the band across the chest. Now that you're at the starting position, make sure that your jaw is fully relaxed and that your tongue is even resting on the roof of your mouth. This will ensure your neck stays relaxed through the motion. Now we can begin. Begin by gently rocking your neck back and forth over the foam roll as you turn your head from side to side. Perform 5 repetitions. Once that's done, now begin to nod your head up and down with emphasis on neck extension. That is, attempting to look up and back at the wall that's at the top of your head. While you're performing this exercise, be sure not to move too aggressively, rocking over any bony prominences or causing irritation. This should be gentle. It should feel relaxing, very much like a massage to the neck muscles. Make sure you're breathing the entire time. Do not hold your breath at any point. After 5 rotations to each side, add 5 head and nods, both up and down. Relax the shoulders. Bring the hands together, then pull the band once again down across the high chest and repeat the exercise just as before. Perform this sequence 4 times and do this twice a day. Be sure you have the correct diagnosis before attempting this exercise, or you may just reinforce a dysfunctional position and possibly even worsen the pain. So what's the movement health connection here? The truth is we spend way too much time sitting, and for those of us that do attempt to get plenty of activity, it is usually not enough to undo the damage that occurs from sitting in front of a desk during the work or school day. This leads to tremendous stiffness in the neck, upper back, and shoulders as the effects of long periods of time in one position take hold. A lack of ability to use the neck and shoulders independently will cause a tug of war, in a sense, between the regions that lead to muscle tightness, overuse, and eventually headaches and pain. Restoring neck and shoulder movement independence and getting the correct support and function from the right places at the right time is key to returning to and enjoying pain-free activity. This is why we're using the rubber band to engage the shoulders and the scapula. We're essentially locking the shoulders in place as we ask the neck to move in gradually increasing ranges of motion and even getting a gentle neck massage at the same time. Again, keep in mind this exercise is just one piece of a larger recovery picture and by itself is not a long-term solution for significant headache, shoulder pain, and upper back stiffness and tightness. So if you'd like to learn more about better movement and how your neck and shoulders can begin to work independently to decrease your pain, then the first step is to make sure you have an accurate diagnosis that considers regional movement patterns so you can begin to experience the benefits of specific and targeted gain of function activities that restore peak performance. Click the schedule button. Let's make sure you're not wasting your time practicing exercises that may not help. Thanks for watching. I'll see you here again soon.